Good afternoon, everyone. Welcome to this Spotlight program. I think you're going to find it an interesting topic, one that we don't normally think about or talk about, but I probably need to engage with.
Yeah, what is this, a mansion? Now we have a movie theater?
And we're going to ask you to mute your microphone.
I know what that closet is.
Hi, Ellie. Could you do us a favor and put your phone on mute? Thank you.
Okay, with that, I think we're going to start. My name is Dave Myers. I'm the director of the Berks Alliance, and this is one of our Spotlight programs that we run occasionally to highlight interesting things, interesting organizations, developing in the community. It's my privilege to work with John Weidenhammer, who is the chair of the Berks Alliance, and I'm going to turn it over to John briefly for some quick comments.
Good afternoon, everybody. Thanks so much for joining the call. I want to thank Dave Myers for setting up this important topic today. I also want to thank our presenters who are going to take us through, I think, really something that's very interesting and really that I don't know much about, though I am a cat fan. We had a cat for about 18 years in my house. In any event, most of you know by now that the Berks Alliance is a community development organization, and we have a focus on trying to improve the health, wealth, and education attainment of our community. But we think it's really important to bring to the community topics of interest that can change the way we understand or the way we think about certain topics, and can really try to rally the community around things where the community can benefit from a deeper level of engagement. So that's really why we try to bring you these topics, and we're really thrilled that we have, what I think of as a fan base that likes to tune in and view these programs that we put on. So again, I'll thank Dave Myers. I'll thank all of our presenters and their fine work in putting this together, and I'm sure Dave will do this, but I'll just remind everybody to do us a favor of putting your microphones on mute. That helps with the quality of the audio experience for everybody. So Dave, back to you.
Thank you, John. So the way we'll do this is we'll move to our presenters here in a minute. We ask you to use the chat function at the bottom of the screen to submit your comments and questions. We will get to those once we get through the presentation. Any ones that we don't get to ask, we will share with our presenters, and if they have responses, we'll get that out to everybody. As John mentioned, we do ask you to mute your microphone so we don't get a lot of background noise, but keep your cameras on because it's good to know we're dealing with live people. We record this, we post it on the Berks Alliance website, we share it with our friends at BCTV, and we send a copy of the video to everybody who registered for the program, who can feel free to share it with anybody they choose to share it with. So with that, we're going to get started, and it's my privilege to introduce Ashley Mikulski, an old friend who's with the Animal Rescue League of Berks County, and Carolyn Fitzgerald is the senior strategist for the Eastern region of Best Friends Animal Society. Ashley and Carolyn, to you.
Thank you, Dave, and thank you, John, for having us. We're really excited to be here in this forum and talk to a different group of people than we normally talk to. As Dave said, I'm Ashley. I'm the CEO of the Animal Rescue League of Berks County, and we are one of Berks County's largest animal shelters that deal a lot with community cats. So I'm really thrilled to be able to talk to you about this topic, and truly honored to have our co-presenter here, Carolyn, with us from Best Friends, and I'll let Carolyn talk about what she does.
Hi, everyone. Thank you so much for having me and Ashley to talk about community cats. I work for Best Friends Animal Society, which is a national organization hoping to achieve no kill through 2025, which means we reduce the animals of cats and dogs that are dying in shelters in America every day. My job specifically works with shelters in Pennsylvania, New Jersey, Delaware, and Florida. I'm really thrilled to be working with Berks Animal Rescue League and to be here to talk to you guys. I'm a Pennsylvania native. I'm located in Philadelphia, so this is really near and dear to my heart. So we'll just jump in to set the stage and go through a number of definitions because I'm not sure how familiar everyone is. We all know what a cat is. We've seen Garfield, the Cheshire Cat, but I want to go through the different types of cats we see. So we're not just talking about cats that live in your home that your Aunt Sally had while you were growing up, that beautiful Persian. We're going to talk about cats that are living outside and different ways we perceive them in our industry. So community cat is an umbrella term that refers to any of the domesticated cat species who live outside. The cat could be stray, so it's wandering around, it's an indoor-outdoor cat, or it could be feral. They're not pet cats, their homes are outdoors, and they live in what we call colonies, right? So a feral cat, which is different than a cat that is just fed outdoors or is friendly towards humans, is a cat who's never had any contact with humans and whose contact with humans has diminished over time. So these cats are not socialized, they're generally fearful of people, they're unadoptable, but what they do is they survive and thrive in colonies, which is their outdoor homes, and they don't rely on us for their basic needs. So a colony is a group of cats that have bonded together. So just like you think of a hippie colony, right? We live together in a commune. They're sometimes maintained by community cat caregivers. So they do come out and provide basic sheltering, especially in Pennsylvania winters, with cat houses, and also provide food and sometimes water sources if it gets too cold outside. Colonies do depend on their caregivers, right? So next slide, please. So now that we set the stage, we really want to talk about when people see stray cats and what we really want to encourage the community to do. So a nice fact, among cat owners, 31% are allow their cats to spend some time outdoors. And you'll see more why we reference this quote later in the slides. Next. So just a brief history of cats. We may think of cats as being domesticated over all this time, especially when we see like Egyptian statues with all their lovely cats, but cats were not predominantly inside until the 1940s when cat litter was invented. Cats generally have been inside and outside for generations, and they can thrive in an outdoor environment. Them living outside is not inappropriate. So quick fun fact, I want to go over some data. So Best Friends is a data-driven organization, and one of our goals is to collect data from all of America's shelters and communities to understand and really prioritize programming to reduce the animals being killed in shelters. So from last year, 4.76 million cats and dogs entered 3,964 shelters in America. I think when we hear of these numbers is quite staggering, right? And we'll talk more about Pennsylvania data in a minute. 3.97 million were saved, which means the rest did not exit those shelters alive. Next slide, please. So the beautiful Commonwealth of Pennsylvania. These are somewhat new numbers. We're releasing our 2023 data set coming out soon. 96,000 cats and dogs were saved in Pennsylvania shelters this year. 5,475 lost their lives. What we know about Pennsylvania data is the majority of deaths right now are cats. We have a variety of no data communities. Berks County is not one of them. Overall, our save rate, which is the amount of animals leaving these shelters alive, is 86% as a state. Next slide, and I'll hand it over to Ashley.
So how this pertains to Berks County, and one of the challenges that I think many of us can understand, no matter what industry we're in, is that data can be really hard to collect. So there is no centralized data system for Berks County specifically when it comes to pet population statistics. However, using a study that came out of the Veterinary Medicine School for Wisconsin, the Outdoor Cats Population Calculator, and FEMA, there is an estimated 30 to 60,000 free roaming cats in Berks County alone, and that number continues to grow. Even with TNR clinics, which is trap, neuter, return, which we'll talk about here shortly, like No Nonsense Neutering, the Fairchild Foundation, the Animal Rescue League, and Humane PA, those clinics are booked out for months. So we know that not only is the population high, but the demand for support services around these cats is also very high. A really interesting statistic is the Animal Rescue League can track all of the phone calls and requests that come into our system. So we get over 10,000 phone calls a month, of which over 65% of those are related to the cat concerns, both in our community and with pet owners. So the need is enormous, both in Berks County and nationwide. And there are ways in which we can help this problem, which we'll talk about here in a second. So Carolyn, why don't you touch base on this slide?
So we'll go over why is this happening in common community complaints. When we're looking at this, what we know, and this goes back to the data slide in Pennsylvania, is about 2,400 cats were killed in Pennsylvania shelters during that year. Of those, that intake, it was 95,400 cats were intake into Pennsylvania shelters. So we do deal with issues of pet overpopulation, which is where these complaints can come from into ARL Berks. There's also effects on wildlife. So cats who have nuisance behaviors, digging up in your yard, tearing out insulation, ruining the garden. These are typical complaints we hear. Yowling, you know what stray cats sound like when they're outside, right? And some of these can be mitigated through interactive animal control policies with animal control officers doing complaint mitigation, and also looking at spaying and neutering those cats who are living outside. We always have to have a public health aspect. So are these cats vaccinated for rabies? What are they attracting wildlife? Do we see, especially in Berks, which is more rural, coyotes coming down, mountain lions, things like that, which can draw more of a crowd there. When we talk about caretakers, and we're so appreciative of our community cat caretakers, as new people who may be coming into this feeding local cats, really want to be starting to prevent attracting additional wildlife into those areas and making sure the areas are clean and tidy to eliminate issues with neighbors or attracting other wildlife to that area. We've also heard a lot of complaints about cats suffering outside. There can be issues with injured animals, cats fighting, your cat gets into your yard and a dog gets out. There's things that can happen. By controlling the community cat population through trap, neuter, vaccinate, return, we can diminish the number of cats coming into shelters and living in the community over time. We'll get more into that later on. Next slide, and I'll hand it over to Ashley.
So what do we do about it? And for decades, many shelters and municipal leaders and cities have tried to figure out ways in which to manage this community cat overpopulation. But most of the tactics out there that are not being carried out by animal welfare professionals are frankly inefficient. So one of the most common ways that we've been doing for decades is commonly referred to as catch and kill or catch and remove. Many shelters for many years were just bringing in these cats that are not considered adoptable because they are unsocialized or they have homes in the outdoors, and just euthanizing them. And for decades, shelters did this because there was no positive outcomes for them. This does not work, and we'll talk about why all of these here don't work with something called the vacuum effect, but I'll save that for the end. Adoption through shelters. Everybody, you walk around your community and you see a cat and you want to be a good citizen, you pick it up and you bring it to the shelter. Not every cat that is outside needs to be in a domesticated home environment. So adoption through shelters for cats that have never been around humans, to take them from their outdoor environment, which is considered their home, and to bring them into a shelter system and put them into a cage to interact with humans that they've never had any experience with, is not only terrifying, but could be considered cruel in certain situations. This is not an appropriate outcome for cats like this. Relocation is another tactic that people have tried to do, and ultimately ends up not only being inefficient, but really disorienting for the cats in which you're trying to relocate. So to pick them up from their current environment where they have patterns, where they have an established caretaker, and to drop them off in an unfamiliar area without resources, not only is disorienting, but can also lead to really unnecessary cat death as they try to find their way back to the territory in which you took them from. And then feeding bans is something that we're seeing come out of a lot of municipal agencies, in that the thought is, well, if we stop feeding these cats, they'll all just go away. And what we end up seeing there is that people are still going to feed cats. Those that are what we call colony caretakers or care for cats will still feed them. And this ultimately discourages proper colony maintenance. So these caretakers, because they're afraid of fines or repercussions, end up not sterilizing their colonies, end up not doing vaccinations because they're afraid of the punitive results that will come of these feeding bans. And all of these don't work because of something called the vacuum effect. So when you have cats in a territory and you remove them from that territory, new cats will come in to fill the available space. And with the statistic that we talked about in Berks County, between 30 and 60 free roaming 30 and 60,000 free roaming cats in Berks County. That is a constant flow of acquiring new territory. When we do proper TNR, which we'll talk about in a second, those cats maintain their territory and keep others out of it. So you won't have this constant vacuum effect of this endless supply of animals coming in to take up the space that ultimately removing one cat was thought to provide. So what is the best method? Statistically, TNR is the only scientifically proven method to help control the outdoor community cat population. And this stabilizes the feral cat colonies. And if we didn't define TNR, it's trap, neuter, return, or trap, neuter, spay, return. This humanely traps cats in their environment, brings them into either a clinic or a shelter system, gets them proper vetting, sterilization, and then returns them to their habitat. And we'll talk a little bit about the kind of cats that qualify for this, but these are cats that are thriving in the outdoor community and the outside is their home. And I really want to stress that not every cat that is outside needs a properly domesticated home inside your sofa. This is their home and they're thriving in that environment. It improves their lives both by getting them vaccinated and making sure that they're not out there continuing to have litters, which contribute to all those human complaints that we saw earlier in a slide. It addresses a lot of the needs of the community. Cats that have been sterilized will not result in fighting, which is typically what you hear, all that yowling sounds out in the community. Disease mitigation is something that is easily preventable through vaccinations, and you won't have consistent new populations of cats being born in communities that ultimately contribute to some of those complaints. And like I said, this is the only scientifically proven method to work for reducing community cat populations. And as we see for the clinics that do exist in Berks County right now, the demand is extremely high for these clinics, and there are not enough resources right now to go around. All right, Carolyn, do you want to talk about how animal control and a shelter-supported system work together?
Sure. Thanks, Ashley. So animal control and a shelter-supported TNR program or SNR program goes a long way into reducing the number of cats killed in a shelter. Very clear. It improves the community with caregivers. What we've found in different places is because animal control can be enforcement-based with feeding bans and rounding up cats and bringing them in when we know they're not going to do well in the shelter who are feral cats, is by having a really robust SNR, TNR program, it reduces that conflict between animal control officers and community caregivers of cats, and it creates a holistic solution to the community cat program in your neighborhood. This also increases the live release rate from the shelter system, which sounds like a whole bunch of mumbo jumbo, but this increases the number of cats leaving the shelter alive because we're not bringing in cats that would not survive in the artificial environment of a shelter. Taking a feral cat who's had no socialization with humans and putting him in a small kennel, even the most lovely house cat, and Ashley can attest to this, does not do well in a cage, right? These are animals who need space to show their normal behavior, and a small space does not do that. We know there is a direct link between cats in sheltering systems and developing an upper respiratory infection or kitty cold, which reduces their likelihood of adoption and can really stress the shelter system, making them invest more money and care into these animals. So it's also more animals are leaving alive and it's more cost efficient. It increases the return to home rates. So this is a fun fact, and we talked about that before in the Not All Wander Who Are Lost. Most cats are reunited of their own accord. They're coming back to home. They're seen in a neighborhood. They wander into Miss Susie's house down the way. She puts up signs at the church and they go back to your house. If you have an indoor-outdoor cat, typically the cat will be known as Tom on this block and Timmy on the other block because cats will self-select into their own homes. So not only do they return home quicker because most people are looking for cats outside, they will remain healthier being outside. And if they're indoor outdoor, they probably have another family down the way that you guys just don't know about. It also decreases the population at the source. So I actually talked a lot about the vacuum effect. So as we're neutering or spaying those cats, having them vaccinated for safety of everyone to reduce disease, they are then dying a natural death outside and not reproducing into that colony as the resources grow smaller naturally, removing this over time. So by having a comprehensive community cat program at a place like ARL Berks, it will greatly reduce the overall community cat population of Berks County. Next slide. And back to Ashley, I believe. Yes.
So how does this affect Animal Rescue League specifically? And if you look at our intake numbers, and this data is from last year specifically, blue is the total number of intakes and orange is those that are feline specific. More than 66% of our population coming into the shelter at any given time that needs support are cats. And like I said, that phone call log of about 6,000 phone calls a month that are all related to cat related issues. So this is our biggest interest of the organization, is how we can improve lives for cats, not only in homes, but in our community. And then the statistic on the right is of the feral cat, of the cat intake that came into the shelter, how many did we return back to the field? And we'll talk about returning to the field, not just feral cats, but something that we call friendlies. This number will continue to grow as we continue to support cats where they're living with their caretakers. And that is only really made possible by a comprehensive community cat program. So we're really excited to be able to continue to positively impact cats' lives and have them not only not enter the shelter altogether, but push them through our clinic in a way that sterilizes vets and puts them right back out to the area in which they're thriving. All right, Carolyn.
So one of the biggest questions we ask when we do return cats to field, which is we spay or neuter the cat, vaccinate it, ear tip it so it's recognized as a community cat that's already spayed or neutered, and we put it back to the place we found it. That's called return to field, or RTF. Feral cats aren't the only felines who deserve to remain outside. There are cats who present as super friendly. People say, hey, they're adoptable. We encourage the organizations to put them back where they are. Why do we do that? The cat is already living in that community and may be an indoor-outdoor cat that we've just taken from Miss Sally's home. You know, Tom wanders in and out. He goes out at 12 every day. He comes back at 12 every night. And we've taken that cat and we've removed it from its home. She's less likely to come into the shelter to pick it up. And he was healthy and thriving there. There are community cats who are social to humans, but don't do well in the shelter and are thriving well. That means they have a great body score. They look healthy. They're husky. They're eating. They're displaying all normal behaviors. The biggest pushback any organization gets about this is, will you just return everything? Which is not true. Every animal will get a vet exam and an assessment of, is its quality of life as it enters this pathway, this course in its shelter life, can it actually be put back outside and thrive? What no organization is encouraged to do is to place a cat outside who shows unkemptness, right? For whatever reason. Maybe it is a cat that is not actually thriving outside. It has a low body score, it's low weight, its gums are pale. Why did this cat come in? Does it have some underlying disease, or is it just not able to survive in an outdoor environment? That would not be a cat that, you know, Ashley's team would put back outside. So we do encourage, for efficiency and for best practices, is to place the cat on a community cat pathway in the shelter and then have it reevaluated based upon a set of standards by the veterinary staff and experts at a shelter to determine its eligibility to go outside. Next slide, and back to Ashley, I believe.
So what can you do about it? I think the biggest thing in our community, and you know, this webinar is a perfect example of it. I'm so glad that it is recorded so that we can share this out in our community, is to educate others on the issue. There is so many misconceptions in the animal welfare industry specifically, but especially around cats. Like I mentioned, some of those ordinances like feeding bans, we are starting to see them pop up, not only in municipalities, but also in apartment complexes and homeowners associations like that. We want to advocate for changing those local ordinances to benefit cats in the community. There's a whole lot of data that we can present. So if you're interested in being an advocate for that, talking to your community leaders or your homeowners association on why those don't work and how ARL could be a solutions provider, we would love to support you on that. If you have feral cats in your community that you don't believe are currently being managed, you can start trapping in your neighborhood. There are a lot of, like before I mentioned, TNR clinics. ARL is one of them that can help you use TNR as a resource to help control that population and make sure that those cats are being cared for properly. If you are managing a colony right now, be a responsible colony manager. Get those animals sterilized, get them vetted, make sure that you're keeping an eye on who's there, making sure new animals that are coming in are being TNR'd as that happens. help others understand how to use deterrence. I think we are very humble enough to understand that not everybody loves animals, not everybody loves cats. There are very avid gardeners out there that don't enjoy their gardeners being used as a litter box or torn up or have cats hanging out on their patio furniture. There are something called deterrents that are humane alternatives to keep cats away from your property, things like coffee grounds or citrus. There's tools that you can use that with a simple Google search, you can find humane deterrents, or if you'd like to have some recommendations of what they may be, please feel free to reach out to the Animal Rescue League. They're often very inexpensive and pretty easily accessible. And we really want to discourage people using harmful techniques to keep animals out of their backyards or their yards. And then obviously supporting local organizations that are making a difference by volunteering your time. If you're really interested in getting involved in this issue specifically, you can help TRAP. If you would like to donate to a TNR clinic so we can continue to offer really low cost services for our community, that's a great way to help this issue as well. And then I want to touch on a comprehensive community cat program is just a part of overall animal control. And there is so much misconception, especially in Berks County, about what animal control is, what services are related to that. So a comprehensive animal control program includes a community cat management and sterilization program, but also disease management. When you have a rabies case, how is that handled? What trapping, what vaccination clinics? How do we work with the Department of Health? Real-time stray pickup and humane housing, local ordinance enforcement, police and social service agency assistance, and a great example of how animal shelters specifically that do animal control help people just as much as we help pets is in the event that we just had a case like this, there's a welfare check and police need assistance entering a home because there's animals in the home, or in the event that a human has to go to the hospital. Comprehensive animal control programs allow human service agencies to do their work and allow us to assist on the animal side of it. And then next slide. So of Berks County, there are 73 municipalities. 43 of them have some kind of animal control contract with varying agencies. And that could be something from as robust as a comprehensive program to only helping out with cats or dogs, to not doing any kind of pickup location and they're just a housing facility, to not having any impact at all with farm animals. And only 6 of the 73 municipalities have a comprehensive coverage package that allows all of those things that I mentioned on the previous slide to be able to help not only the residents, but the police officers as well. In many other states, animal control is a countywide solution, of which Berks County has never been able to provide. And that really ensures continuity of services for all residents and animals. That really Berks County would be a great thing to work towards in the future. But right now, this is where we're at. Only 43 of the 73 municipalities have an animal control option. And for those 30, I'm doing my math right, that don't, the residents and their pets really do have a gap in services. So community cats, I think, is the thing that people see the most. Stray dogs, police assistance are all encompassed in a really important animal control solution. So Dave, I'm going to kick it back to you for questions or comments, and Carolyn and I will be here to assist with that.
Very, very interesting program. Actually, I'm going to ask you to bring up the PowerPoint again. I want you to go back to the numbers you were showing us at the very beginning, for both you and Carolyn, the national numbers, the state numbers, and then the county numbers, because I think there's a powerful numbers. That's 4.76 million cats and dogs. And if you divide that by the number of shelters, that's about 100,000 per shelter. I did my math right. That's a lot. In Pennsylvania, almost 100,000 dogs and cats. And this one, the 30 to 60,000 free roaming cats in Berks County. I don't think people really understand the extent of the problem. What can you say about that? Is there any more you can tell us about that? Is it as big a deal as what those numbers seem to indicate?
Yeah, so I'll share a really interesting statistic, and Carolyn, I think you might be able to have the actual data here, but I think there's a common misconception on how quickly cats can reproduce and how many cats they can have in a litter. And there's a statistic, and I wish I had it in front of me, but it's something crazy, like one breeding pair in their first litter can produce like 400,000 cats in 7 years. And that's just one breeding pair in their
Wow.
first litter. So you times that by the amount of feral cats that we are estimating to be out in the community. Cats can have about 2 litters a year. They can have, up to 5 or 6 kittens in their litter. This challenge can get out of control very quickly, and without proper resources to do sterilization and the volunteers to be out there and do the trapping, because not every resident has the experience or wants to be able to do that. That's how we arrive at these numbers. And as those reproductions continue to happen without proper support of TNR services right behind it, you can easily see how that number outpaces our ability to sterilize these cats on an annual basis.
That's just, it's amazing. You talked about colony managers and community cat caretakers. What are they? Who are they? How do you become one? What do they need to know to do it?
Carolyn, do you want to answer this one?
So anyone can be a community cat caretaker or participate in trap, neuter, return projects. Your best start would be connecting with an organization like AOL Berks, or any of the other ones in your area. Alley Cat Allies, Best Friends Animal Society, Maddie's Fund has great information on how to get started. Really, it's just as much or as little as you want to be involved. I personally used to volunteer at trap, neuter, return clinics in Philly, and would just help with paperwork. They need everything from people to, regularly commit to feeding community cats in their community, making winter housing, which are fun. You can get like coolers and stuff them with straw, making trap covers, financially supporting TNR projects. If you would like to help on the shelter end of things, coming in and volunteering and helping on surgery days. Also just talking, like when you see a stray cat, talking to people about cats who are outside, right? It is normal for them to live outside. Do they have caretakers? Identifying caretakers. And we can also follow up, provide resources of how to get started on doing that in your area. We can tailor them for Berks County.
So they can reach out to you for more information about doing that.
Yeah, you can reach out to us at the Animal Rescue League. We are currently recruiting TNR volunteers. We have a couple active projects and we'll continue to do so. We right now have TNR clinic days every other week at our surgical center, and we'll be moving that to once a week sometime here in the next couple of weeks. And with any of that, the biggest strain on our resources is not necessarily the sterilization procedure, it's the getting cats to the facility and back and trap training. And so many of our community members may not have experience in that. So to have volunteers that are willing to assist would be wonderful. And I do see that Stacy Perlucky is on the call. She's with Opportunity House, and they manage a feral cat colony right outside of their building, and they've been a great partner.
Yeah, we have so many layers of issues with our cat colony, which I typed just a little paragraph, but we have over excited feeders, which don't always, sometimes they feed them the leftover lunches from the shelter, which isn't good for the, intestines of the cats. Clients either refuse to come in because they don't want to leave their pets, so they live in either a tent or their car, which isn't good for the cat or the human. And then there's people who just drop kick their cats literally to the curb and come in. So we have a lot of domesticated pets in our colony. The clients love it. It's really good therapy for them. But our feeders, like I said, we don't have the budget to buy a lot of the food, get the vet care that the animals need. So we do have volunteers that come in and, clean the houses that we have donated, with straw and things like that. And we have the food grant from Dr. Jen, and we just need a lot more TNR and just a lot more resources, because not only do we have the clients with their pets, we also have the train tracks. So a lot of the animals come across train tracks and they see food and then they don't leave, because you feed an animal they stay. So, there's new ones all the time, so we just need, I don't know how, like, just more resources, because the volunteers that we have are fostering and using their own money and things like that, so. I've taken a few home to TNR them, and they're in my garage, and that kind of stuff, so we just need just more resources, and I just don't know if there's. I mean, I think, we used a nice chunk of that grant that you had from the Giorgio Foundation to get our colony up and running, so, but, it's getting bigger, not smaller, so I don't know if that's normal.
Yeah,
Um,
Susie, I'm happy to talk to you.
It's just, there's so many layers to our colony, but it's a wonderful thing, but it's a lot.
Yeah, I'm happy to touch base about that. And that Georgie grant was actually through the Humane Society, who also does.
Oh, okay, yeah, because we
Um,
use them for like a broken leg and other things.
Yeah, they have a
Yeah,
hospital
it was a
down
lot.
I'll
So,
reach out to you separately and set up a call about how ARL can better support. with
yeah,
that.
and I know, like, I was wondering if we could have the bus come, because a lot of our neighborhood, the residents in our neighborhood don't have access to transportation or vets to get to, so I think that we would have a really good response from the neighborhood,
So
Yeah,
so
we-
a lot of our cats are the neighborhood cats are in or out, so they impregnate our colony, if that makes any sense.
And what Stacy's referring to is we just announced a new mobile adoption and clinic van that has had 2 events so far. We have our first microchip clinic coming up this Friday. And at some point we'll be able to do a lot more clinics downtown in the city of Reading as well. So that is a really exciting project that we have of other ways that we can help not only cats, but other own pets in the community.
Talk about the mobile clinic a little bit more, if you wouldn't mind, Ashley.
Sure,
If
yeah,
people
I wish I
haven't
had a picture to show, but it's a new asset to our organization. It is a mobile unit that will allow us to do adoption events. We can house up to 18 animals inside of it, which we can bring our animals to the community. We get a lot of requests for this, and it is easier to have them in a contained environment that's air conditioned and it's got a heater. It allows us to do events anywhere in the community, but also prioritizing those next to pet stores or other places that also promote some type of pet related service. And then separate from that, it also has the ability to be a mobile clinic. So microchips is the #1 way to reunite lost pets back to their owners. So we'll be doing, that's what Friday's clinic is tomorrow, a microchip clinic. And then we'll also be able to do vaccine and wellness clinics in the future to get pets vaccinated. Often one of the biggest barriers to pet care is getting access to a veterinarian, which is right now a national crisis. But this will allow people to get their pets up to date for vaccines, and some are legally required, as well as just general wellness appointments to make sure the pets are getting the basic care they need in the community.
So how can a neighborhood go about getting a clinic to come to it? And do you post where they're going?
So we don't have it scheduled right now posted. The goal for clinics is to get to that doing once a month. The short-term goal is to host one every 3 months, but I would recommend that they reach out to their municipality. We'd like to partner with local municipalities first to set up in their parking lots at their borough center or police stations is a great way for us to partner with their local municipality. If you're in a contracted area, we are working to do those either grant funded or at no cost, but if you're in an uncontracted area, there'd be a minimal fee for that. And we are always looking for sponsors. So if you live in a community and you would love to be a sponsor of one of those clinics, please reach out to me. And that would allow us to provide these services to the community for free.
I know we have a couple people who are community officials, community leaders participating in this. I don't know, they want to weigh in and talk about, is it an issue in the community they're in? I think we have a couple from Reading area. Shelbear, do you want to say anything? I know I'm nudging people probably wrongly, but
I needed to unmute myself first, sorry. Yes, we heard loud and clear from some residents it was to start a 1-block area of the borough about a year ago about a feral cat colony that we believe was started by a resident on that block who has some mental health issues. We're attempting to work with the Office of Aging as well as the ARL to get the cats that she was bringing into her house. They were, breeding, having kittens. They were being allowed to come and go from her property, impacting the neighbors. there was another resident on that block that kind of took it upon herself to work with the colony, set up, she was basically as a full-time job trying to trap these cats, taking them to no nonsense neutering to get, I believe the colony's around 13 in number, was successful in getting them all TVNR'd, and that seems to have solved the problem for that specific block, but it was a huge educational outreach on her part with some of the other neighbors. You know, I've talked to her at length about what kind of undertaking that was, that she had friends that are now enemies because they don't understand how TVNR works, that, you know, as soon as a cat is taken out, that vacuum effect, another cat's coming in. Since then, we've had other areas of the borough that we know that there's feral cat colonies cropping up or have cropped up. Our concern, I think, is we're doing everything a little bit in our own vacuum, and we can't stem a flood that's coming from other communities that aren't doing anything. So on the other side of this conversation, I have a great relationship with Ashley and the ARL in general. YMSing is trying to partner. That microchip clinic tomorrow is actually at our fire station, which, you know, we're extremely proud to host. We pushed out information about that this morning through our website. But I think moving forward, there needs to be a bigger community conversation amongst the municipalities that are seeing this issue. I live in Robizonia. There's a feral cat colony there. I'm not aware that anything's being done about it. You know, one of my suggestions would be maybe having the Center for Excellence in Local Government put together some type of forum specific to this topic, and then bringing in the animal control partners to not only educate, but okay, let's talk about resources and let's talk about doing this as a community group, not individual municipalities, because that's not going to solve anything.
Thank you. I will do this as a favor to everybody. I will send a video to Paul Jansen and give him that nudge. So good point.
Thank you, appreciate it.
The trap neuter return program. So you're offering to do that. How long does it take to go through it? What are you looking for in terms of the people participating in the program?
So if people are interested in participating in trap neuter return, let's say on our clinic days that we're offering right now every other week, it's a pretty quick process. Once they get to us, animals are dropped off in the morning, they're sterilized, and they're returned back to their environments when people pick them up the same day. There's a lot that goes into that. There's trap training. We do have traps available for rent at the shelter. There are some people that have them themselves. There are volunteer groups in the community that already exist that will help with some trapping. If you've never trapped before, there's a little bit of a learning curve, of which we are very happy to educate people on how to do that, show you how to rent the traps, how to set them, how to do trap training. Once you have the hang of it though, and you're actively trapping cats, the process as far as sterilization on our side is very quick. And for example, not every day you're going to catch the cats that you're hoping to. So there is a certain element of failure from that perspective, but there are more than enough cats to be sterilized, so I don't foresee that would be an issue. So if someone is interested in doing it in their community or needs support, again, please reach out to me. Let me get to, I can reshare. I'll put my email in the chat so you guys have a direct line to me. Either we can assist you or we can set you up with a volunteer that currently exists in the community to get animals sterilized through us. In the event that there are neighborhoods or homeowners associations that are interested in doing more of a coordinated approach, we currently are doing a case study right now at a local apartment complex to get some of their TNR programs up and running and get their cats sterilized. So we have flexibility to help in a lot of ways. Like I said, we're trying to get that sterilization clinic down to 1 day a week at this point.
We talked a little bit about animal control officers. Who typically would be an animal control officer in a community? Is it a policeman? Is it a different public official? Is it somebody whose job is dedicated to that?
It's a great question, and it's rather nuanced. So animal control and what we call HLE, or humane law enforcement, often cross paths, but they are separate functions. So there are humane law enforcement officers, and I am not an expert in this. I will give you as much information as I feel comfortable sharing, but I do have much more educated people on staff that can help with this. But there are humane law enforcement officers, and then there are animal control officers. Animal control is really meant to enforce local ordinances that are set by municipalities and townships. And there are training involved in both. There's certifications that are involved in both. There's a cost associated with that and continuing education, just like we see with human police officers. A lot of the same functions of enforcement, and a police officer that works for Wyomissing Borough has the same authority to enforce rules as does a humane police officer or an animal control officer. But we want to make sure that police are out there doing human services for their communities. And that's why we highly advocate that most municipalities or townships have an animal control contract. Really, there's no bachelor's degree or any requirement in order to do that. A certain degree of expertise in animal handling is highly desired. Animal Rescue League has had several animal control and HLE officers in our past. And again, there is training that we push our officers through to go and figure out all of the laws and rules around how to be an animal control or humane law enforcement officer. But yeah, really anybody can be, but there is a certain amount of education required.
Are there good models that you've seen for animal control programs and for humane officers in our county or elsewhere? That we
I'm
could
gonna let
replicate?
Carolyn answer this more from a national perspective, but to your point, Dave, the most robust and comprehensive animal control program in Berks County has been ARL for the last 15 years. Prior to us doing that, Humane PA had done it for several years, but I would really prefer Carolyn talk about the national models because there's a lot of different ways in which this is
Okay,
run
good.
and effective in other areas.
Yeah, and it really depends on the state you're in, what animal control and humane law enforcement looks like. It does vary from state to state. There's no overall national requirement for animal control or humane law enforcement. For instance, in New Jersey, depending on the township or municipality, animal control officers are privatized and are contracted as a service. So it looks very different. In Pennsylvania, there's a lot of no service areas actually, so that we don't have anyone enforcing animal control ordinances. The National Animal Control Association, NACA, sets national standards and provides training to officers to provide consistency across the country. And I would reference them for anyone who's interested in looking at what would be the best practices nationally. Each state is a little different. Like Ashley said, ARL Berks has been doing this for the past 15 years in this county. And the coverage for animal control depends heavily on the municipalities and township for what they sign up for.
I think the last point I would like to make about animal control is it's robust, and to truly do it in a comprehensive way with professional staff and resources isn't cheap. And I think that's been an issue that we've had in both the Berks County community, but nationwide, in that if you're going to do it well and you're going to do it humanely, that's why privatization of this animal control program is important, because organizations like ARL, which are a no-kill shelter, can do animal control, but in a way that fits our model and is a humane option for animals. Having vehicles and staff and a veterinary service and experts that can help with humane deterrent like Community Cats is all part of a comprehensive program, which is why we really advocate. And I'm going to point out Michelle because she's here, that municipalities like Wyomissing work with an organization like ARL so that we can help in all their community needs. Within the last couple of years, we had a rabies case in a certain municipality, and for us to come in and touch down and bring resources and our staff and our traps and do vaccine clinics as a follow-up to a positive rabies case, and even to do the rabies testing, all requires a lot of expertise and staff and talent and resources, which is, again, I will continue to say this, is why it's so important that our community has a comprehensive animal control program.
You've mentioned that people should think about bringing the cats in, trap them, neuter, and return them back to the colony. How long do cats live? How survive in a colony? Any idea compared to what a cat living in my house might be? Do you have any idea about
I think the last thing I saw, and don't quote me,
that?
recorded, it would be 7 to 10 years in a managed colony. So a colony that has a caretaker. So we can also send out further resources from that. But that's the last thing I remember seeing.
So 7 to 10 years. That's a fairly long life.
And we think about, I know what we tell adopters, cats can live up to 20 years, so be prepared, right? A 5-year-old cat is still considered a young cat. So there is a difference between indoor and outdoor cats, but living well in a colony, we're thinking 7 to 10 years.
It's good. It's supportive in that way.
Can I raise a question? Can I raise a question?
Yes, you may, Donna. I was going to call on
Hi,
you.
Dave. How are you?
Good,
We
how
used to
are
work
you?
together at Alvernia. I'm a foster parent at the ARL. This is
Thank you.
really like this is really outside of current practice, but I wonder if this couldn't be considered on a nationwide level. And that is that we sometimes like train people, who are not vets or vet techs to do vaccinations. Could there be instituted, again, this is a long process, but some kind of training program where people could be trained just to do neutering and spaying? I mean, even like an additional certification that vet techs could get, or vet assistants, or even just to do the male kittens and cats, which is easier surgery. I just thought of this right this second, but it seems like, I know everybody's territorial about their profession, but with such a shortage, and the truth of the matter is, vet hospitals could admit more students. I mean, that's where the problem is, why we have overall have a shortage of vets. But what do you think about that crazy idea?
It is harder to
Uh,
get into vet school than it is to get into medical school.
I know,
That's
but
the
it doesn't have to be. That doesn't have to be, is my point.
And,
Yeah.
and I'm interested in the answer to this question. The first dog we rescued because the family tried neutering him and he had to go through 4 subsequent
Yeah.
surgeries.
We're not talking about do it yourself. Yeah.
No, so I'll
So-
actually jump into this one. So Donna, first of all, your cat was adorable. I saw it on the camera.
I have
So
5 of them. Thank you.
Lovely. This is not a crazy idea. There are some movements in other states to create kind of I want to get the term right, but I am an animal person. So, you have your doctor, then you have your physician's assistant, right? That's the
Mhm.
medical people on here.
Mhm.
There is this kind of movement to create the secondary class of certification. Veterinary medicine is controlled at the state level, and vets are licensed in the state of Pennsylvania, right? So any changes like that would have to be taken at the state level in this state. There is a bill in the Florida House to create this secondary medical resource that would be kind of like a physician's assistant. I forget the bill number. I can find it if anyone's interested in it. That's possibly going through those houses now to create this other classification that could provide a higher level of veterinary resource to assist the lack of veterinarians currently in our community. Right now, there is a national veterinary shortage if this group is not aware. So encourage your children to apply to vet school and become vets, because we really do need them, and we really do need shelter specific vets, right? There are shelter medicine tracks at most veterinarian schools. It is a really fulfilling career, someone who's worked in sheltering for a number of years. And we really do need more vets in our community. So you're not a crazy person, Donna. It is something that is being discussed. If I wish I could remember the first time I heard it, I think it was at Humane Society United States Expo, maybe like 2 or 3 years ago, and it might have been in West Virginia or Tennessee. Oh, thank you, Jose. Jose dropped it in the chat. And so it might be coming, and if this is something the community would advocate for at a state level, this is not a bad idea. We'll see how it works in other states as well.
Okay, well, that's good. That's like gonna only solve the problem years down the road. I would say, because even to be a physician's assistant is a lot of training. I was talking just about one specific, this is what you're trained to do. Could you learn that in 3 months or something, But I could see there would be pushback towards that, but try to be creative, right?
Yeah.
Yeah.
Well, thank you, Donna. Actually, the things we've talked about aren't all that the Animal Rescue League does. Is there anything else you want to mention in the brief minutes we have left?
Yeah, sure. And thanks for that. So yes, we have a lot of programs at the Animal Rescue League. And I think one of the common misconceptions is that we help people just as much as we help pets. So I'll talk about our pet help center in that we really try to keep pets where they're at in their homes. And we would like the shelter to be a last resort for many of our pets. If we can help them where they're at, whether it's through training, scholarships, food support systems, veterinary care, even just counseling on how to navigate through a temporary hardship. We are here to our community to help them solve their current and temporary solutions. And they just happen to have pets too. Obviously, if you're interested in adding a member to your family, we do adoptions through our shelter. We have foster in the event that maybe you can't have a full-time pet, but you're willing to help us, especially right now in this critical season of overpopulation where our kittens spike and our population spikes at the shelter. We are desperately looking for fosters who are interested in either caring for bottle babies or kittens that aren't quite available for adoption and may be eating food, but just need to get out of the shelter system. Obviously, we do animal control and humane law enforcement functions. We have a really dedicated team in our what we call Department of Animal Protection that goes out and investigates cases of animal cruelty, neglect, and complaints from our community to ensure animals are being treated properly. We also have a whole suite of medical services. So like TNR is obviously one of them. We are also doing our vaccine and microchip clinics. We will be opening up wellness sometime in the near future with that mobile van. And I think that's the gist of most of our services. Like I said, we tend to serve about 5,000 animals a year in the shelter and serve about 10,000 total by helping our community. We really want to be a resource for people in our community. And I think I really want to stress that ARL is a judgment-free zone. And I think a lot of people don't ask for support because they're afraid of embarrassment or shame or concern. And we want to let everybody know that we are here to help you. We do take 10,000 phone calls a month. So in the event that you don't get someone right away, please leave a voicemail. I know that can be frustrating. And animal welfare is a very nuanced and challenging industry, and there is so much education to be had. So we are always open and interested in helping anybody understand how they can help people and pets. And we are here as a resource. So thank you for the opportunity for ARL to be here and talk to a diverse group of people. And a special thanks to Carolyn for coming in with her national expertise. We have really increased our relationship with Best Friends recently and will continue to work towards saving more pets, both in our shelter specifically, but in the county as a whole.
We had a comment, a question about, do you do end of life care?
Yes, thank you. That was one of our staff put that in there. Yes, we do offer end of life services in the event that you are in the difficult decision that you need to make an end of life decision for your pet. We do offer that as well. We try to offer that on a limited basis because it is an emotional and taxing service for our public. But in the event that you do need some type of service like that, especially if you're unable to get into a veterinarian, please give us a call. We will try to help you as best we can.
And
just a big, can I just say just a big thank you to all the staff out there and all the full-time at the Animal Rescue League and all the full-time animal workers. You're amazing.
Thank you, Donna. I know several of our staff are on the call, so I wish I could have planned that better, but thank you. We have an extremely dedicated group of staff who work so hard. And like I said, animal welfare is confusing and challenging. And I appreciate our community being kind when they call in because our staff truly want to help as many people as possible. They don't do this for the money. You don't get into nonprofit if that's the case, and they care so deeply for animals. And I appreciate you saying that, Donna.
I'll second what Donna said, because I tell Ashley every time I'm out there, God bless those employees, because I would love to be able to do what they do, but it breaks my heart every time that I go there. So I'm glad there are people that can step up and do that.
And I see hearts floating and hands shaking. So this is great stuff. One last thing that I can ask. Animals do include more than dogs and cats. Do you deal with more than dogs and cats?
Yes, thank you. So we are very, very fortunate to have 10 acres on our facility. If you've never been there, please come for a tour. I did put my contact information in the chat. I can show you around, but we have a barn and some pastures at our shelter. And most of the animals that come in that are farm animals come from cases that are directly related to our humane law enforcement or animal control cases. So we have had a history of having horses, pigs, all manner of fowl. We just placed a pig that had been in our care over 550 days. She made it across the entire country down to Georgia to finally get adopted. But yeah, those animals tend to be in our care a little bit longer because they typically have some expensive medical needs while they're awaiting, their final placement. So we do deal with all manner of strange things. Most of our reptiles do go to a rescue partner. We had an alligator last year. We've had some weird things, but we traditionally do small animals like rabbits, guinea pigs, ferrets, as well as obviously cats and dogs, and then our fair share of farm animals as well.
Great. Well, thank you for all the work you're doing. Ashley, thank you for the presentation and the suggestion for this program. And Carolyn, thank you for joining us. I think it's it's sort of like a hidden topic that people think about only when they sort of bump into a pet on the street, but really powerful, important sort of thing. And they are important parts of our lives. So I want to thank everybody for joining us today. We will send out a recording of the program to everybody with the contact information for our presenters, and we'll send a copy of the PowerPoint presentation as well. So I mentioned we'll put it on the Berks Alliance website. We'll put it with BCTV, and feel free to share it with other people. I'm going to harass Paul Jansen with it, so feel free to do the same sorts of things. Thank you, everybody, for joining us. We hope to see you again sometime soon.
Thank you.
Bye-bye.